Intramuscular injection, as the name indicates, the injection is given into the muscle, intramuscular, into the muscle tissue. So in this picture, in the skin, if you are giving, that is intradermal. If it is in the subcutaneous tissue, subcutaneous injection. That too we have studied. Next is intramuscular, that is into the muscle. Muscles have good vascular supply. Medications are absorbed more quickly than when they are administered subcutaneously. Muscles-ന്റെ പ്രത്യേകത അവിടെ നല്ല വാസ്കുലർ സപ്ലൈ ഉള്ളതുകൊണ്ട് നമ്മൾ ഐഡി കൊടുക്കുന്നതിനേക്കാളും സബ്ക്യൂട്ടേനിയസ്ലി കൊടുക്കുന്നതിനേക്കാളും മോർ ഫാസ്റ്റർ ആയിട്ട് ആൻഡ് മോർ ബെറ്റർ ആയിട്ട് മെഡിസിൻസ് അബ്സോർബ് ചെയ്യപ്പെടും. Medication administered by this route begin to work in less than an hour, and the duration may last from hours to weeks depending upon the type of medication. Definition of intramuscular injection: introduction of the drug into the body via muscles is termed administration of intramuscular injection. A form of parenteral administration in which the medication is injected into deep muscle tissue. Purposes: to obtain quick action next to intravenous injection. നമ്മൾ ക്വിക്ക് ആക്ഷൻ കിട്ടാൻ വേണ്ടിയിട്ടാണ് ഇൻട്രാമസ്കുലർ ആയിട്ട് കൊടുക്കുന്നത്. ഇൻട്രാവീനസിന് ആണ് ഏറ്റവും ക്വിക്ക് ആക്ഷൻ, അത് കഴിഞ്ഞാൽ പിന്നെ വരുന്ന ഇൻട്രാമസ്കുലർ ആണ്. To avoid irritation which occurs when administered through other forms. മറ്റ് ഫോംസ് വഴി കൊടുക്കുമ്പോൾ ഇറിറ്റേഷനൊക്കെ ഉണ്ടാവുന്ന ഒഴിവാക്കാൻ വേണ്ടിയിട്ട് നമ്മൾ ഇൻട്രാമസ്കുലർ ആയിട്ട് കൊടുക്കും. പർപ്പസസ് കഴിഞ്ഞു. അടുത്തത് നമ്മൾ നോക്കാൻ പോകുന്നത് which are the medication that is already been discussed. Certain vaccines such as hepatitis vaccine, COVID vaccination, certain analgesics like diclofenac and tramadol, antibiotics like streptomycin and certain penicillin and all, certain hormonal injections. These are given as IM. Then contraindications: if the patient has impaired coagulation mechanism, like if patient has any bleeding disorder or any coagulation disorder, we should not give. Then occlusive peripheral vascular disease: if patient has any DVT and all, we should refrain from giving IM injection. If the patient has edema, then post thrombolytic therapy, because these conditions increase the risk of bleeding. If patient is on OPVD or if patient has undergone thrombolytic therapy. Then sites for giving IM injection: intramuscular injection are given directly into the central area of selected muscles. In selected muscles into the central area, we will give IM injection. So these are the four main areas: deltoid, ventrogluteal, dorsogluteal and vastus lateralis. Deltoid is into the deltoid muscle, center of the deltoid muscles, that is on the upper arm. Then vastus lateralis and rectus femoris, that is over the thighs in the anterior aspect. Then dorsogluteal, this is not recommended nowadays, but I will show you where it is. In this, the injection is given into the gluteus maximus muscle over the hip. Then ventrogluteal, that is the most favorable site where we have to give painful IM injections in adults. So this site is over the hip only. How it will locate, that we will discuss the following slides. So first is deltoid muscle. The deltoid muscle located laterally on the upper arm can be used for intramuscular injection. That is laterally on the upper arm. Originating from the acromion process of the scapula and inserting approximately 1/3 of the way down the humerus, the deltoid muscle can be used readily for IM injection if there is sufficient muscle mass to justify use of this site. So when we are taking deltoid muscle, the patient should have sufficient amount of muscle in that region. Those are too emaciated, preferably to avoid deltoid muscle. How to identify the deltoid muscle? Repeat for the acromion process on the lateral aspect of the upper arm with non-dominant hand. Use your non-dominant hand. Palpate the acromion process. Reach the lateral aspect of our palm for the acromion process. Insert needle 2 or 3 finger bit below the point at a 90-degree angle. See, here is the acromion process. Okay. So here we have to keep our palm. So keep your little finger over the acromion process, or keep the lateral border of your fingers. Okay. The 3 finger bit below. So this portion is the region where we have to give IM injection on deltoid muscle. Okay. So let's see. In a person, we are keeping our palm here, 3 finger bit below. Here is the site, and there we have to give the injection. Okay. Next is dorsogluteal. It is not commonly used due to injury to sciatic nerve. When we are using dorsogluteal region, there is high risk for injuring the sciatic nerve, so this set is not preferably used. Divide the buttocks into 4 quadrants. Inject the middle of the upper outer quadrant. See, this is the buttocks. Okay, we are dividing these buttocks into 4 quadrants, and this upper outer quadrant is considered as dorsogluteal, but we are not using this dorsogluteal injection site nowadays. Okay, we are injecting into the gluteus maximus muscle. This is how it is given in dorsogluteal. Patient is made to lie down in prone position, and we are dividing the buttocks into one buttock into 4 quadrants, and upper outer quadrant is used for dorsogluteal. Next is gluteus medius muscle or ventrogluteal muscle. The gluteus medius muscle, which is also known as the ventrogluteal site, is another commonly used site for IM injection. So how to identify this location? Face the patient. We have to make the patient lie down on the side. We have to face the patient. We have to turn towards the patient. Palpate for the anterior superior iliac spine with the index finger and spread the middle finger along the iliac crest. Our palm should be placed over the greater trochanter. Index finger should be over the anterior superior iliac spine, and the remaining 3 fingers has to be spread over the iliac crest. The middle point between the triangle formed by the index finger and the middle finger and the crest of the ilium is the site for injection. The triangle formed by the iliac crest, the middle finger forms area suitable for intramuscular injection. And palpating the point, use right hand for the patient's left side and left hand for the patient's right side. എങ്ങനെയാണ് നമ്മൾ വെൻട്രോഗ്ലൂട്ടിയൽ സൈറ്റ് ഐഡന്റിഫൈ ചെയ്യുന്നത്? വളരെ ഇമ്പോർട്ടൻ്റ് ആണ്. നിങ്ങളിത് എന്തായാലും അറിഞ്ഞിരിക്കണം, ചോദിക്കുമ്പോൾ പറയാൻ കിട്ടണം. ആദ്യം നമ്മൾ make the patient lie down. We have to face the patient. Our palm should be placed over the greater trochanter. Palm has to be placed over the greater trochanter, facing towards the groin. Thumb should be placed towards the groin. Groin avadikayirikkanam thumb. Index finger should be placed on the anterior superior iliac spine. Other 3 fingers spread over the anterior superior iliac crest. And the triangle formed in between the index finger, middle finger and the anterior superior iliac crest, about the iliac crest. This triangle, that is the point, അതായത് T, which is the palm over the greater trochanter. ഈ കാണുന്നതാണ് greater trochanter. Thumb is towards the groin. നമ്മുടെ ഒടിയനാണ് groin എന്ന് പറയുന്നത്. Thumb towards the groin. Then index finger over the anterior superior iliac spine. Other 3 fingers spread over the anterior superior iliac crest. This triangle formed between index finger, middle finger and the iliac crest. This triangle is the point for ventrogluteal muscle. Okay. Then make the patient lie down like this. See how this man is placing palm over the greater trochanter, thumb towards the groin, index finger over the iliac crest, spine, other 3 fingers. This point is the site of injection. And give an injection in 90-degree angle. Next is vastus lateralis muscle. For IM injection, as it is generally thick and well formed in individuals of all ages, it is not located close to any major arteries and nerves. ഇത് നമ്മൾ IM injection ഉപയോഗിക്കും, കാരണം ഇത് ഭയങ്കര തിക്കാണ്, അതേപോലെ തന്നെ developed ആണ്, not close to any arteries. Also readily assessed. Middle third of the muscle is often defined as the injection site. പിന്നെ നമ്മൾ അഡൽട്സിൽ അധികം വാസ്റ്റസ് ലാറ്ററലിസ് അങ്ങനെ വരത്തില്ല, നമ്മൾ കുട്ടികളിലാണ് ഇത് ഉപയോഗിക്കുക. Third muscle can be determined by visually dividing the length of the muscle that originate on the greater trochanter of the femur and inserts on the upper border of the patella, tibial tuberosity through the patellar ligaments. ഇത് ഒറിജിനേറ്റ് ചെയ്യുന്നത് എവിടെ നിന്നാണ്? ഗ്രേറ്റർ ട്രോക്കാൻഡറിൽ നിന്നാണ്. ഇത് ചെന്ന് അവസാനിക്കുന്നത് പെറ്റല്ലയാണ്. ഗ്രേറ്റർ ട്രോക്കാൻഡർ തൊട്ട് പെറ്റല്ല വരെ ഈ മസിലുണ്ട്. Palpation of the muscle is required to determine if sufficient body mass is present to undertake the procedure. അങ്ങനെ നമ്മൾ ഐഡന്റിഫൈ ചെയ്യുക, divide the thigh horizontally and vertically into 3 portions between the greater trochanter of the femur and patella. അപ്പോൾ ഫീമറിൽ നിന്നാണ് ഈ മസിൽ തുടങ്ങുന്നത്, അവസാനിക്കുന്നത് പെറ്റല്ലയാണ്. അപ്പോൾ ഇതിൻ്റെ ഇടയിൽ നമ്മൾ ഹൊറിസോണ്ടലും വെർട്ടിക്കലി 3 areas ആയിട്ട് ഡിവൈഡ് ചെയ്യുക. അതിൽ സെൻട്രൽ പോർഷൻ, ഔട്ടർ മിഡിൽ തേർഡ് ഇസ് ദ സൈറ്റ്. നോക്കിയേ, ഔട്ടർ മിഡിൽ തേർഡ് അല്ലേ, നമ്മൾ ഇങ്ങനെ ഡിവൈഡ് ചെയ്തു. ഓക്കെ, ഇങ്ങനെ ഡിവൈഡ് ചെയ്തു. ഇതിൽ ഔട്ടർ മിഡിൽ തേർഡ് ഈ പോർഷനാണ് വാസ്റ്റസ് ലാറ്ററലിസ് ആയിട്ട് കണക്കാക്കുന്നത്. And for the procedure of IM injection, we will refer the procedure manual.